Hello, my name's Angela Sheedy and I'm here to explain Assessment 2 for HSC318 Semester 2 2019. Assessment 2 is asking you to prepare a health program proposal. It's related to your learning outcomes 1, 2, 3, 4, 5 and it's worth 40% of your overall mark. Now we've put the word count at 1,500 words for this, but we have provided a template for you to use as part of this assignment, and you'll see how the actual word allocation is divided up around there. This is due in week 8, okay, on Friday, and that's Darwin time by midnight. So why is this assessment relevant? Well, again, as health professionals, you're going to have opportunity to apply for grants as part of an organisation or as an individual, and that's generally to run health promotion programs, do research projects, healthy living programs, things like this. Each grant application requires different levels of information. However, they're all going to want to know who you are, what you want to do, why you want to do it, what you hope to achieve by doing it, how much it's going to cost, and how long you plan to for your program to take. So this assessment presents you with the opportunity to apply for a mock grant to run a health program in a rural and remote area. It'll introduce you to the terminologies and information often required when submitting a grant application. Again, we've chosen some areas for you to concentrate your health program on, and these are again based on what we're seeing highlighted by the Australian Institute of Health and Welfare as more priority areas for improving health outcomes for people living in rural and remote areas. So we're going to ask you to choose one of the following topics to design an innovative health program to run in a rural or remote part of Australia. By innovative health program, we mean we want you to come up with your own idea, okay? Not using an idea that's already been used by another program, or not presenting another program as your own, okay? It needs to be your own new idea. We want you to present your program by completing a grant application, and we've given you a template for this, and we'll follow that up in the next slide. You need to identify an actual rural and remote Australian community to run your program in, so you can't just make up a pretend community. We want you to be looking around. If you live in Victoria, you might choose a rural remote area around Victoria region, and so forth, okay? If you're a little bit stuck on that, just get in contact with me and let me know. Or have a look in Module 1 and 2, where we actually take you to some of the maps that show you how we locate and allocate funding and so forth for different rural and remote areas. So you'll be able to sort of maybe choose a place from those mappings. Now, your program can be addressed at any target groups. So, for example, you might want to focus your program on children's health, or it might be for health workers to better educate them about something, or it might be for farmers, etc. So the topics we've asked you to focus on for this assignment are addressing illicit drug use in rural Australia, or oral and dental health in very remote Australian communities, or managing chronic pain in rural and remote areas, or increasing physical activity in rural Australia. So you need to choose one of those topics to come up with a health program. Okay, as you get started on this assignment, what you really need to think about is your program goals, and make sure that you keep these nice and clear and reachable and follow the SMART format, okay? So that means they should be specific, measurable, achievable, relevant, and time-bound. To briefly go over the grant submission template, you can find a link to this in the assessment outline for Assessment 2, and it's pretty easy to fill out. So I've given you a set number of boxes to basically be filling in required information, and of course at the beginning of any grant proposal you need to put things like your name, what the name of the program you're proposing to run would be, and in this case, of course, because you're students, we've asked you to identify what student course code you are, and that'll help me know if you're a midwifery student or a registered nurse, a nursing student or a health science student, etc. It helped me give me a little bit of a context as to where you're coming from within your program as well. This information here is just to sort of give you the heads up that with any grant application there's going to be a set of rules and requirements that you'll need to be following, and quite often that will be whether they can put your grant out for public viewing or not, or do they need to keep it as confidential. So I've included this information here and related it more to the assessment. Okay, so moving on with the grant submission template. Initially we're asking you to do an executive summary, and that's around 300 words, which is pretty generous really. What this is asking you to do though is provide a short outline, and we usually use this in business cases and things like grant applications, that basically gives us a really nice synopsis of what it is your proposal is going to be. So by the time I've finished reading your executive summary, I should know exactly what it is that you intend to achieve with your grant. We're also asking you to then outline your key outcomes. Okay, so what does the program aim to achieve? What are your aims? Whereabouts are you going to run it? Who is your target group going to be and why? Provide I said 100 words here, so a brief outline of them. Who else is going to be involved? Who are your stakeholders? And what is the program activity? What are you actually going to do? Key performance indicators are a terminology often used in any grant applications, and so if you're not quite sure about these, then I'd ask you to actually look this up. Okay, this is about you doing a bit of research into the background of what's needed in this assignment. Okay, and then putting down what your key performance indicators would be for your program. Funding allocation. Previously on your form you would have seen that we've given you two options for this grant application. You can have a certain amount of money to run it over 6 months or 12 months. I want you to think about how you might need to allocate that type of funding. Again, there's a lot of resources out there to help direct you in this area. We're not asking you to obviously give us a massive budget cut down. That's unrealistic for the purpose of this assessment. But we do want you to start thinking that when you are out in if you are going for these sorts of grants, or if you're running projects, they come with a budget, and you need to be able to show that you can be responsible for managing that, and that you'd understand where different funding would need to be allocated. So that might be for things like printing materials, for hiring an additional person in. Okay, we want evaluation criteria. Again, with these programs, evaluation is really important because it helps us see if the program achieved its key performance indicators and its aims. And if it's got really good evaluation results, then it might be something that they would then offer you more money to run again. This is a mock project. We're not expecting you to do this project. So the evaluation criteria has to outline how you intend to evaluate the program. References comes in as part of that academic requirement, but again, it's important if you're referring to health organisations as your stakeholders and so forth, they should be in your reference list. So as the reader of the grant, I know where I can find out a little bit more about them if I want to, because you've given me the source and the link to go to their web page and things like that. Same if you refer to some research to back up your proposal, then you should be referencing that here. So very briefly for your preparation, you should have completed modules 1 to 4 before commencing this assessment, as you'll find information that's going to help you in those areas. Again, visit the Australian Institute of Health and Welfare website and your other set text. I've put a link here for give you a little bit of a guide on writing a grant application, but there's plenty of different resources out there that you can refer to help you in this area. Again, as a third year unit, we're expecting you to do a bit of your own background research in getting this assessment together. Okay, don't forget we've got our health science library guide there for you to refer to, and there's already some really good resources for this assessment hosted there for you. Okay, so for your presentation, we have provided you with a template to use for this particular assessment, and it is mandatory to use. Okay, so that means you have to use it. All right, we want you to use standard academic writing, which means you might need to form paragraphs in some of those areas that we've asked you to fill in. If you're unsure of how to move forward, if you had some feedback in assignment 1 that says this is an area you need to improve in, we've put a link here just to give you a little bit more to link you to some resources to help you better develop your academic writing. I've just outlined the font that we prefer you to use, and of course the reference list at the back using the APA style. Now, with this particular grant application, even though it is something you're proposing to do, we're asking you to use third person, so no I or me in this particular. So this would be, instead you'd write the health program aims to, rather than I aim to. Save your submission as a Word document and title. So this is pretty much the same as what we've done with assignment 1 as well. Okay, make sure you label it properly with your name and your student number and the unit code, and please make sure no PDFs or zip files, Word documents only. The rubric that we've prepared here, again, gives you a nice breakdown of how we're going to allocate marks for this assessment. So it's really important that you read through this. Always go straight to the excellent column, okay? Don't read the unsatisfactory or limited. That's not where you want your assignment to be at. Aim for the highest grade you can possibly get. So have a look and see what are we expecting from you to be able to give you your top marks. So assessment criteria number 1 in this rubric is presents an original health program for a rural remote Australian community using the grant template. And then area 2 is that you've got evidence of researching and using the literature effectively, so you've got that evidence to back up your program. You'll see in this rubric we've got the usual marks allocated for referencing, but we've actually upped the marks for your written expression, structure, logical sequencing and flow of information, because it's really vital when you're doing these types of applications that you've got very good written English, so the person who's reading it understands exactly what it is that you intend to do. Okay, you'll also see that it's word bound, so there's certain areas where we've said you can only write 50 words or so, and that's actually very common on these types of documentations and these forms. So going over the word limit, for example, might mean that your grant application is too wordy and doesn't actually get read effectively. So as you see, we've allocated 20% for marks for this, and so that means about really staying in the boundaries of what's required in completing that grant application, and also making sure that the information that you present is presented coherently and is easy for the reader to understand, written in plain English. That pretty much sums this one up. If you're not sure how to get started, and you've watched this outline, then please contact your unit coordinator. You can find their contact details in the LearnLine unit. Okay, please make sure you do ask if you've got any questions, because we'd hopefully make this a good assignment for you and something that you could then tuck into your professional portfolio to show that you've had experience in this particular area. Okay, so good luck with assignment 2.